So come in, send is safe, we've got our correct PPE on, which is our gloves, glass and our mask. We can do our ethane report, which is our exact location, type of incident, hazards, access, number of patients and other emergency services. A general impression of a patient is he's sitting in front of us, he's not cyanotic, there's no accessory muscle use, he's not tripoding, and his eyes have spontaneously looked at me when I've walked in. We've got our full 360-degree access to our patient, and at this stage there's no life-threatening hemorrhages that I can see, and the mechanism of injury does not warrant a C-spine precaution. G'day mate, my name's Josh, I'm from the ambulance service. What's your name?
Wayne.
Wayne. So at this stage we're going to work out that the patient's airway is patent. If the patient was unconscious, we would manually open the airway, consider suction if there was anything in there, and then insert an airway. Well, moving on to our breathing, the patient isn't using any accessory muscle use. We look at our rhythm and our rate, which looks quite normal at this stage. We just need to have a quick list of your lung, mate. Is that going to be all right?
Yes.
So we've got gained consent. We just want to listen and watch the lung, comparing each side of the chest to the other. Make sure that everything's all equal. I'll just slide this up underneath your shirt, mate. Just have just a nice deep breath in. Excellent. So just comparing both sides, make sure that they're both equal, which is great. If there was an issue with this, we'd then consider our oxygen therapy. Moving on to our circulation, I just want to have a quick feel of your wrist. Is that all right, mate?
Yes.
So at this stage, we're feeling the skin temperature, make sure it's not hot or cold. We are seeing whether it's fast or slow, regular or irregular. We do a cap refill, which is less than 2 seconds, which is great. And we've got no clubbing of the fingertips. Disability, we want to just squeeze my hands as hard as you can. Excellent. Coming down here, push up on my hands. Yeah, and push down. Excellent. So the patient is able to squeeze both my hands, which is great. Exposure, we just want to have a quick look, make sure there's no rashes, bruises, anything going on there. We want to expose the chest and the abdomen as well to make sure that's all fine. Can you just lift your shirt up? Excellent. So we just want to make sure that it's all nice and good. Working through our GCS as well. Can you tell me what day it is today, mate?
Monday.
Monday. So the patient is able to open an eye spontaneously, so he gets a 4. He's orientated to today, which is a 5. He's able to follow my commands, so he's got a 6. Patient is GCS 15. Just want to have a quick look at your eyes, mate. Is that going to be all right?
Yes.
Just look forward for me. Excellent. So the patient's pupils are equal and reactive, and they're sitting about a 4 at this stage, which is great. After this, we're going to move through our vital signs, get our BP, our heart rate, our respiratory rate, VGL and our temperature. We're going to go through our sample and find out our signs and symptoms of what's going on today. Allergies, medications, past medical history, last meal eaten and events leading up to this.